Yeah, but that's also going to be one very sick individual. To have that kind of a suppurative infection going on in the pleural space is not going to be somebody's running around having a good day. They're having a very bad day, actually. All right, and this last one. This is a real interesting kind of a complex case. You see this little arc of lucency? Mm-hmm. Stomach, air, diaphragm. Liver, air, diaphragm, pleural effusion. That is the diaphragm thickness right there. Why isn't this diaphragm same thickness as this one? The patient has two things. The patient has pneumoperitoneum, which is pneumothorax. It's just air in the abdominal cavity. But the patient also has a very unique pleural effusion pattern. This diaphragm should look like this one, and it doesn't. And the reason it doesn't is because there's a pleural effusion sitting right over the top of the diaphragm. The diaphragm and the lung are like this. What happens is the pleural effusion accumulates under the lung base and lifts the lung base up off the diaphragm. If there was no pneumoperitoneum here, this would be missed, because it symmetrically lifts the lung base off, and they still look like they have a what over here? They still look like they have a costophrenic angle. Still looks nice and clear. And this is a small amount, but if we didn't have the pneumoperitoneum, that's not a big difference in the two diaphragm level to even be concerned about it, because you've got 2 to 3 centimeters above or below. If the other one's in there somewhere, it's probably normal. But a subpulmonic effusion can sometimes lift the thing way up here like this. Then it's going to be very noticeable. It's a very, very strange pleural effusion. Most pleural effusions just accumulate in the bottom, and then they just start filling up toward the top. This one lifts the lung base symmetrically off, and we have no idea why some people do that when they have a pleural effusion. It's called subpulmonic or infrapulmonic effusion, under the lung. Infra or sub, under the lung.
If you give it more time, would it fill up more or not necessarily?
Yeah, but what it'll do is it just lifts the lung base up, and it's like an accordion. It just keeps compressing the lung base as it lifts up like that. It mimics an elevated hemidiaphragm is what it does.
Bless you.
Pleural effusion. We'll talk about this in the pleural section, but here's a really nice example of it. And you can only tell because they have the pneumoperitoneum. It's the only reason.
Thank you.
Okay?